Hi all. Till other participants join, perhaps I would like to utilize this opportunity with the participants to reiterate why we started GEVO, what is the broad idea, and how it can be a game-changing platform for the African doctor community, of which majority of the audience is here.
Hey, but for me, I'm French. I speak well French in French. I understand English, but I'm not very good
Okay,
in
we
speaking.
will. So we have Shivansh here.
Yeah, hi.
Shivansh, yeah. So Shivansh, you can translate that till we are waiting for more participants. I'll just share the idea behind Geo and how it can be a game-changing platform for the Geo doctor community. Can you translate this, Shivansh?
Donc, monsieur va commencer avec les détails sur Jivo et pourquoi ils ont commencé, pourquoi ils ont débuté Jivo et quelle est l'idée
Shivansh,
derrière.
Shivansh, this background noise at your end or?
No, it's not at my end because I can hear it as well from the
Okay,
line.
okay. Okay. So can you translate it again because we were not able to hear you.
Uh, yeah, the noise is really there.
To the participants, I have one request. Please, if you are not speaking, please mute your microphone.
It's actually Nebu Said. C'est la personne de laquelle nous entendons le bruit. Oui, oui, merci. OK. Monsieur a dit il va parler de l'idée derrière Jivo et pourquoi ils ont commencé ce startup et
Okay,
quelle est...
Shivansh, please stop there. I don't know what you're translating. Whatever I say, just repeat it verbatim. Okay.
Yes, sir.
So, why we started GEVO is to transform the cross-border healthcare delivery. And how we are doing it, Shivansh, you can translate this line.
Nous avons commencé Jivo pour, pour la santé, pour les services de santé à travers les frontières.
Basically, this is the broad concept. On one side, we have the best Indian hospitals and the top specialists. So, for example, today we have Dr. Puneet Girdhar, who is one of the best spine surgeons in India. And by corollary, if he's one of the best in India, then probably one of the best in the world. And he's from, I can personally vouch, he has treated multiple of our patients and everybody has been happy so far. And he's from BLK-Max Hospital, which is among the top 5 Indian hospitals, no matter who is making the list. So this is the kind of expertise we have on one side of GEVO. They are the healthcare delivery experts. GEVO, we are experts in e-commerce and technology, and we are using technology to bridge this gap. And on the other side, our primary audience is doctors like you, who practice in very difficult circumstances. The broad idea is creating this tech platform and leveraging expertise of doctors like Dr. Puneet Girdhar and hospitals like BLK, supporting you into two things. One, serve your patient better. And if any of your patient needs intervention abroad, provide them a channel, which is high trust channel and where no agents are involved anywhere. And as you're aware, these needs, I mean, in Africa, you are aware better than us that there's a huge gap in what is the demand in terms of what is needed and what is available. That's why patients are forced to travel to other countries to look for suitable treatment.
Vous éclairez dans les endroits sombres où toutes les autres lumières seront éteintes.
And by creating a network of doctors like with the support of Indian hospitals, what we are trying to create is for the patients who need intervention abroad, we are trying to create a high trust recommendation and support channel for the patient so that they don't have to depend on agents to undertake their journey.
Uh,
Basically, the doctors that
I'm
we
very
find
sorry to
promising,
interrupt, sir. There's a lot of background noise. People are not muting themselves, so it's hard to follow.
yeah, I understand, but
Arun,
like
can I interfere here?
yes, sir, yes, sir.
Is there a common administrative control to mute everyone?
I have been doing that, sir.
No,
But
because there is this. It is coming from Zamba, the voice.
Yes.
Zamba. I will mute Zamba.
Yeah.
Okay.
So it happens
I will mute
sometimes. It
my
happens
book.
with all of us that somebody has forgotten to mute themselves. Yeah,
Yeah.
I think that will solve for now for the time being, and then we can always allow them to join in for a conversation for any questions later.
Correct, sir. So
Thanks.
basically, what's going to happen is when you are a part of the Geo Doctor Network, you have access to hospitals like BLK and Dr. Puneet Girdhar. And if you have any questions, even you face a difficulty, you just direct it to your Geo relationship manager. It will reach Dr. Puneet Girdhar. And the promising ones from this network, Geo, along with the support of hospitals like BLK, we are going to enhance your capabilities and we are going to make sure that you have a healthy pipeline of those patients who need treatment in India. And not only this, slowly and steadily, we will start building capabilities in your local healthcare system so that the loop is closed. If we are able to succeed in this, so there will be Geo Doctor Plus, and in the next phase, we'll start bringing clinics in your countries on Geo platform, diagnostic centers and hospitals and so on. So I have a few announcements to make. Right now, all of you are interacting with us through WhatsApp groups. From 1st of July, you will have your own software to help you in this MVT practice. If you want to use it for your local practice, you are free to use, and the software will be free of cost to you, no licensing cost, no hidden cost for life. By middle of June, Geo Training Academy will be live, where all of you will be trained in the medical tourism process about the things that are right to do, theoretical plus practical. And for the ones who are Doctor Plus, to give them a boost, we will be organizing online OPD, and Dr. Girdhar will be conducting a few where we get people who have spine problems. So now I think time for me to stop. You all are here to listen to Dr. Girdhar. And sir, over to you now.
Thank you, Varun. Thank you, and congratulations on a great initiative. I think it requires a very brave and a consistent effort and a lot of belief in what you are trying to do. And I think it will bring the borders closer, both in terms of skill training for doctors, for awareness. It's always a mutual learning. And also at the same time, it's always an initiative like this is always a win-win for the patients, for whom access also becomes beyond the boundaries. In whatever way we can help humanity through providing the best of the healthcare, I think it's a leaps of effort in that direction. So without taking much time further, um,
Sir, I'm very sorry to interrupt. I just want to say that I'll be translating. So if
okay.
you could pause in between after saying, I could translate whatever you're saying. Thank you,
Sure,
sir.
sure. So I
Vous
think,
m'entendez?
shall I begin with my presentation?
Yes, sir. Yes, sir. Please. Please go ahead.
Je peux proposer quelque chose?
I think someone has some question.
Yeah,
Ok,
only
je dis
Shivansh can
ceci.
help her.
Pour moi, j'entends l'anglais. Mais seulement le speak que je n'ai pas beaucoup, en fait. Vous pouvez parler, j'entends. Vous pouvez aller. Quand j'aurai la question, je vais la poser.
Shivansh, are you able to understand the question? It was asked.
I mean, they're saying that they'll not be able to understand in English. Je vais traduire la parole du français en anglais et de l'anglais en français si nécessaire.
Okay. I think Dr. Girdhar can start, and Shivansh, please, you keep translating for the French speakers.
Yes.
Yeah. Dr. Ambidin is asking, is there anyone who speaks French to translate for us? You can reply in the chat. Shivansh is. We have already replied. Yes. Okay. So, shall we begin?
Oui, vous pouvez. Yes, you
Yes.
can begin.
Yes. So I will try to go through the presentation quickly. Even though I think before even beginning, I'm getting a learning here that next time I'm presenting, I'll keep every slide half in English and the same a copy in French. So that's
Yes.
what I can do next time. So I go to the Google translate my text
No,
into French,
Dr.
and then
Puneet, Dr.
yeah.
Puneet, that has already been done. Your presentation's French version has already been circulated to the French-speaking doctors.
Fantastic.
Our team did that.
Wonderful. But I'll try to keep my text very limited, and I will avoid a lot of adjectives so that it becomes easier.
Okay, I just have one request, Dr. Girdhar, for our African colleagues. They work in very challenging environments. So spine is a very broad area. So if you could give them pointers that when a patient presents certain kind of problems or indications, when should they get in touch with you through the Ajiva relationship manager?
Right. So,
Oui, la colonne vertébrale c'est un sujet très important et s'ils ont un problème de la colonne vertébrale, quand est-ce qu'ils peuvent contacter le docteur Girdhar? Yes, sir, you can continue.
Oui, c'est bon.
So the first slide itself tells that today I will talk on the spinal surgery technology, and spine surgery safety is very important, and it also tells that I work as a head of spine surgery at one of the biggest Max hospitals in Delhi.
La chirurgie épinienne, la chirurgie la chirurgie de la colonne vertébrale, c'est très important. Et Dr. Girdhar travaille à la tête d'un hôpital très important, très célèbre à Delhi.
Ok. Moi, je proposerais ceci. Au fait, je suis une liste in English, c'est très bon. Et je peux même lire. Il peut tout présenter et quand j'aurai la question, je poserai en français, vous faites la traduction. J'écoute.
Si vous avez l'opportunité de
question
c'est pas tout le monde.
Français, je vais la traduire en anglais pour le docteur.
Oui, mais qu'il présente les tout. Il n'y a pas de
tout le temps.
souci. Il ne faut pas traduire sa présentation. J'entends.
Pourriez-vous répéter?
J'ai dit ceci. J'entends tout ce qu'il dit, mais seulement le speak, je n'ai pas un bon speak en anglais. Donc, j'entends bien ce qu'il dit. Il peut tout présenter.
Oui,
Non,
vous parlez de la
bonjour.
présentation?
Bonjour, bonjour. En fait, je crois que c'est mieux de le laisser parler. Après, l'autre, il essaye de traduire comme ça, parce que nous, on n'arrive pas très bien à comprendre l'anglais déjà. Et du coup,
Ah,
ça,
ok.
ouais, c'est pour
Ah,
ça que j'ai demandé à ce que, voilà, il y a une
qu'on traduise.
traduction,
Ah, ok,
voilà,
ça va. Ah oui,
afin
parce que
qu'on,
moi,
voilà.
pour moi, le listening, c'est bon. Ce n'est que parler, je suis pas
Non,
très
là, c'est
bon.
pour toi. Bonjour, bonjour. Là, c'est pour toi.
Shivansh,
Le listening est bon.
Ah, ok, ça va.
C'est
Il n'y a
pas
pas de
pour tout le
souci.
monde.
can you please
il y a
translate for
déjà,
our benefit? Because Dr. Girdhar has to start the talk also. Can you translate for the benefit of English speakers what was going on?
yeah, so they're saying that they can understand, but there is a contradiction because the text is in English. So,
They have, Shivansh, they have been circulated a French copy of the same.
okay.
You can open it on their device, slide by slide,
Il y a,
and
il y
you
a
will
déjà,
translate.
il y a
And you
déjà
will be
une
translating.
version, okay. Il y a
No
déjà une
problem.
version en français qui a été circulée, qui a été partagée à tous les participants de cette réunion. Si vous en avez accès, vous pouvez l'utiliser.
Ok.
Okay, so let's start, Shivansh, and you just please be very coordinated with Dr. Puneet in translation.
Yes.
I think there is not much to worry because the slides, when we move ahead, will have more pictures in spine. I've kept a lot of pictures and it will be easy to understand.
Well, just one question, Dr. Puneet. Will you take questions in between the conversation or at the end? What is your preference?
Whatever way they want. If they, how many, if we have only 29 participants, we can take in the middle also.
Okay.
Il s'agit bien entendu de la commandante Mina Hashiro. Il est annoté qu'elle est très jeune pour ce poste, mais je n'ai pas que 27 ans. Elle peut pourtant s'enorgueillir d'avoir déjà exterminé plusieurs centaines de cailloux. Tu peux être sûr qu'à nous deux, on va bousiller tous les...
Shivansh?
Dr. Girdhar, I think there's some, I couldn't really, because it was not very clear. I think you can continue with it. If there's anything, I will let you know about it.
Yeah. So what you do is, Shivansh, you have to tell me after, when you are done with the French, you just have to say next or Roger something. You just give me indication next. Okay.
Sure. Okay.
So at BLK-Max, we have a huge spine program where we do close to 1,000 spine surgeries in a year. And we see 10,000 spine patients every year. We have a complete spine program, including fellows.
À BLK, nous faisons plus de 1000 chirurgies par an. Et nous avons aussi des fellows, nous avons des collègues qui spécialisent dans le domaine de chirurgie. Yes, sir. Continue.
So this is our spine team and Center for Orthopedic and Robotic Spine.
C'est la photo de l'équipe des chirurgiens qui travaillent dans le domaine de chirurgie de la colonne vertébrale. Yes, sir.
Yeah, you just say next, then I will continue. Okay, it will save time. So a lot of people have back pain. Almost all of us in our lifetime will have some back pain at some point. So only less than 1% needs surgical intervention. Most of them can be managed with medicines and physiotherapy.
Il y a beaucoup de gens qui ont mal au dos. Il y a beaucoup de gens qui souffrent de cette maladie, mais mais il y a moins de 1% des gens avec le mal au dos qui ont besoin de l'intervention chirurgicale. Les autres traiter le de mal au dos. Yes, sir, continue.
Yeah. So the common spine ailments are like in this, one of the commonest one is spinal stenosis. Just show them this picture. This is normal. This is problem. They will understand.
Le problème le plus commun de la colonne vertébrale, c'est la sténose, la sténose de la colonne vertébrale. Vous pouvez voir les deux photos. Une photo est avec le problème et l'autre est sans le problème. Yes, sir, continue.
Yeah. So in spinal stenosis, the primary problem is that they can't walk long distance. They have to sit down.
Le problème avec cette maladie, c'est qu'ils ne peuvent pas marcher pour beaucoup de distance et ils ont aussi des difficultés, ils ont du mal à s'asseoir aussi.
Okay.
Yes, continue.
Yeah. So there are other problems like disc hernia, disc hernia. They can see this picture very clear. Disc hernia, which press on the nerve.
Il y a un autre problème, c'est l'hernie intervertébrale, l'hernie des disques intervertébrales. Et ce problème, vous pouvez voir dans la photo. Yes, continue.
Okay, so the disc problem causes sciatica, pain in the hand or pain in the leg, which is shooting pain.
Ce problème cause la sciatique. C'est le problème qui cause mal dans les jambes et mal dans les bras. Yes, sir, continue.
So then there are other conditions where there is a disc collapse. See this picture, disc collapse. This normal disc, this abnormal disc.
Il y a aussi des problèmes, par exemple dans la photo, où les disques, ils s'écroulent. Yes, sir, continue.
So then there is another problem where there is a fracture and slip. It is called listhesis. There no listhesis. One bone slip on other. There is fracture here. One bone slip on other.
Il y a un autre problème, spondylolisthes, dans lequel un disque glisse et il y a une fracture. Un disque glisse par rapport vis-à-vis à un autre disque. Yes, sir.
So there are many treatments apart from medicine, physiotherapy. The first treatment is medicine physiotherapy. If medicine physiotherapy not work, then injection. If injection don't work, then surgery.
Il y a beaucoup de traitements. Il y a la physiothérapie, par exemple. Yes, sir.
Yeah, physiotherapy, medicine. If it does not work, then we give block, one injection in the spine.
Si la physiothérapie ou les médicaments ne marchent pas, il faut faire la piqûre dans la colonne, dans la moelle vertébrale.
And if that also don't work, then surgery. Surgery with the small keyhole, endoscopic surgery.
Si ça ne marche pas, si les injections ne marchent pas, on doit finalement faire la chirurgie. Cette chirurgie est la chirurgie endoscopique. Yes, sir. Good.
Next slide. So one example, this 65-year-old man with the sciatic pain in the leg, and he try everything but not getting relief with medicine.
C'est un exemple, c'est un cas d'un homme qui a 65 ans, mais il a la sciatique, il a essayé beaucoup de traitements, mais il n'a pas pu soulager la douleur. Yes, continue.
And this patient has very bad damaged disc and joint. So many times you have to tell them, they see, when they see this patient, they have to get X-ray and MRI. If the patient has sciatica and patient give medicine, no relief, after 2 weeks, get MRI and X-ray.
Si un patient a la sciatique, il faut prendre les médicaments, mais si les médicaments ne marchent pas pendant deux semaines, il faut aller faire la radiographie ou MRI. Yes, sir, continue.
When you do MRI, if there is problem like this, see here, joint is damaged, this joint damage and disc also damaged. This normal disc white, this one black damage, and press on the nerve. Disc damage, press on the nerve, joint damage.
Vous pouvez voir, comme dans la photo, il y a des endommages dans cette région. Sir, your voice is a little unclear, I think.
My voice. My voice.
Yeah, now it's better, sir. Yes.
It's better. So now there are, when you have to do surgery, there are many options with endoscope and microscope.
Quand on doit faire la chirurgie, il y a plusieurs options. Nous avons endoscope, on avons l'endoscopie ou nous avons endoscopie. Yes, sir.
Yeah, endoscope and microscope.
Endoscopie et microscopie.
Patients are very afraid, like this picture. If they do surgery, they can get paralyzed.
Les patients ont beaucoup de peur. Ils ont peur qu'ils se paralyseront à cause des chirurgies.
And patients are worrying if they will be in bed for 2-3 months.
Ils s'inquiètent qu'ils aillent rester dans le lit pendant plusieurs mois.
And patients are also worried about expenses.
Les patients ont peur aussi des finances, de l'argent. Yes, sir.
So this slide is telling that the air travel is safer than car travel because of technology.
Sorry, sir, air travel
is safer than car travel because of good technology.
Dans l'écran, on parle que le travail dans le ciel par l'avion, c'est plus sûr, c'est plus sécurisé par rapport au travail par notre voiture.
So in spine also last 20 years, in every procedure, lot of technology.
Notre moelle épinière peut rester pendant 20 ans grâce à la technologie que nous avons évoluée.
Yeah, so at BLK-Max, we have all this technology. I will tell you one by one.
À BLK-Max, nous avons toutes ces technologies et je vais vous le dire un après l'autre. Yes.
So we have 3D CT inside the operation theater for imaging, for CT scan inside the operation theater.
Nous avons des technologies pour faire les imageries en 3 dimensions et MRI, etc. Yes.
We have neuromonitoring for patients for spine surgery. You put electrodes for safety to pass the current check if you are not doing anything which can harm them.
Nous avons aussi la neurosurveillance pour vérifier si l'électricité passe à travers la moelle épinière. Yes.
And we have neuromicroscopes for doing surgery with very good magnification, like you can increase 5 times, 6 times, 10 times magnification and good illumination light for safe spine surgery.
Nous avons aussi la neuromicroscopie que nous utilisons pour magnifier, pour élargir notre imagerie de la colonne vertébrale.
And latest, we have navigation and robot for doing spine surgery, which makes it 100% accurate.
Nous avons récemment, le plus récemment, nous avons aussi les robotiques, les chirurgies robotiques qui font la chirurgie de manière la plus précise.
Also, most of the spine surgery now, endoscopic keyhole surgery, small cut endoscope and microscopic keyhole.
La plupart des chirurgies utilisent ça, microscopic what?
Keyhole, small hole, small cut. I will show you everything in just.
Il y a des petits trous qui sont utilisés pour les chirurgies microscopiques.
Yeah. So now we will go to pictures. This is neuromonitoring during surgery. See the picture. You put electrode in the operation theater and you are checking every nerve like a graph, electrical graph.
C'est la technologie de neurosurveillance multimodale intraopérative qui est utilisée pour surveiller les nerfs.
So they know kind of monitoring in the operation theater for safety in spine surgery.
So your voice lagged right now. Can you please repeat?
I said all kinds of monitoring like EMG and NMEP, all this monitoring in surgery.
Beaucoup de techniques sont utilisées pour surveiller dans le détail. Sir, your voice is going away and coming back. So if there's a microphone that you're using, I suggest that you keep it closer.
Okay, I will do that now.
Yes.
So 90% of surgeries now minimal invasive, minimal, small cuts, see small cuts.
La plupart des chirurgies aujourd'hui ils ont l'invasion, ils ont invasive de très minimal, de quantité très minimale.
And very less pain, very quick recovery in 1 day discharge, walking back again.
Il y a très peu de douleur et vous pouvez sortir de l'hôpital très vite.
Like this, see, this is microscope with small tube surgery to fix all this only from this small tube with microscope.
C'est un exemple de chirurgie minimale invasive.
Yes. So one case again, lumbar canal stenosis, all nerve compress here in the center.
C'est un cas de sténose dans lequel tous les nerfs ont été appuyés, ils ont été il y a du pression sur les nerfs.
Patient cannot walk more than 5 minutes. There is numbness in the legs, no feeling. After 5 minutes, he has to sit down.
Le patient ne peut pas marcher pendant 5 minutes. Il y a engourdissement et il doit s'asseoir.
So with endoscope, see this with endoscope, small hole, all the nerves become free. All nerves free, all pressure we remove in 40 minutes surgery, and in the evening patient walk 1 kilometer, go home. Endoscope.
Avec l'endoscopie, il a été devenu très facile. Tous les nerfs ont été libérés et le patient peut marcher plus d'1 kilomètre après cette chirurgie.
See this video, endoscopic surgery.
Vous pouvez voir la vidéo de la chirurgie endoscopique.
This spinal cord in the center, this nerve, checking all now, complete free after finished surgery time.
Il y a la moelle épinière dans le centre et il y a des nerfs qui ont devenu libres après la chirurgie.
So, like this is microscopic left, this is endoscopic.
Il y a microscopique à gauche et à droite, il y a endoscopique.
So, again, see with endoscopic video, all nerves you make clear, no damage. Same day in the evening, you are walking, go home.
Avec l'endoscopie, il n'y a plus de dommages et après la chirurgie, dans le soir, vous pouvez rentrer chez vous.
Yeah,
Yes.
this is disc here, nerves.
Il y a le disque, il y a les disques, il y a les nerfs.
So this is small, too small cut, all the disc come out, big disc, which was pressing nerve. Patient got immediate relief from pain and numbness.
Tous les nerfs ont été sortis et les nerfs ont été libérés et le patient n'a plus mal.
Then some patient have fracture in the spine, fracture. Fracture, we put cement like this, fracture, and put cement. It's called kyphoplasty. Kyphoplasty.
Il y a des fractures dans la colonne vertébrale et donc il faut ajouter du ciment pour soulager la douleur. Ça s'appelle kyphoplastie.
Yeah, you put balloon first, fracture, balloon to make it increase height, and put cement.
Un ballon est utilisé un ballon est inséré pour soulager la vertèbre qui a été comprimée.
Then for many disc herniation like this, like disc problem pressing on spinal cord.
C'est le problème de hernie cervicale.
We do disc replacement. See, new disc which is moving. New disc here, metal disc.
Il y a un nouveau disque qui bouge, qui se déplace.
This is spinal cord stimulator.
जी metal disc.
हाँ, metal disc. ये रही नई disc. Arrow से दिखाना पड़ेगा.
Disco metal.
Yeah.
Disco metal.
This is spinal cord stimulator. This battery.
Stimulateur de moelle épinière.
And this wire inside the spinal cord wire connect with the battery here.
Dr. Puneet, we were not able to hear what you just spoke. The sound.
There is electric wire going in the spinal cord connected to the battery.
Shivansh?
Electric, sorry sir, what? Electric?
There is an electric wire connected to a battery going inside the spine.
Il y a un fil électrique connecté à moelle épinière.
Like this. Okay, then now we also have navigation and robot. This is robot arm, robot for doing spine surgery, put the screws, cage, robot.
Shivansh?
Doctor, your voice is breaking.
It was clear. You can ask again if you're not.
Yes.
If you're not following, you can ask.
I'm saying robot. Now we have robot for doing spine
repeat,
surgery. Robot, we have robot for doing spine surgery. Robot.
Il y a des robots qui sont utilisés pour faire les chirurgies de la colonne vertébrale.
So this is the robotic arm, hand of robot doing work.
C'est la main d'un robot qui fait le travail chirurgical.
I think signal problem is on that side. So this robot help make spine surgery 100% safe.
Ce robot aide à rendre la chirurgie de la colonne vertébrale 100% sûre.
With robot, you can put in perfect place, screw in perfect place.
Vous pouvez insérer et mettre dans la place qui est parfaite.
See, without robot, 93%. Accuracy, perfection. With robot, 100%.
La précision sans le robot, c'est 93%. Et avec le robot, c'est 100% de précision.
With robot, blood loss is also less. Hospital stay less.
Avec le robot, la perte de sang. La perte de sang, c'est moins et vous devez aussi rester dans l'hôpital pendant plus longtemps. Sans le robot.
Patient walking next day after spinal fixation.
Le patient peut marcher le patient peut marcher le lendemain après la chirurgie.
And accuracy 100%.
La précision 100%.
One small video, how we do robot surgery.
Une petite vidéo de chirurgie robotique.
This is O-arm, 3D C-arm.
3 dimensions, c'est
This is taking CT scan of patient.
C'est le CT scan, c'est la radiographie du patient.
Now, robot planning on the screen. Planning.
La planification par le robot.
So after the planning, then the robot come into action.
Après la planification, le robot vient à l'action.
it comes in perfect place.
Le robot arrive à la place parfaite.
Then a small cut through the robot and you can drill through it.
Un petit coupure à l'aide du robot et vous pouvez aller dans la peau.
And you can have live imaging on the screen. See, live image on the screen.
Vous pouvez voir les imageries en direct, live, sur l'écran.
Blue is planning and yellow is final screw.
Le bleu, c'est la planification et le jaune, c'est le final.
So if you see all images, it go perfect. Blue, yellow match everywhere. Blue, yellow match here also.
Le bleu et le jaune, ils sont congruents, ils sont pareils.
So this is perfect. It says S1 screw perfect. And size also, length also, everything perfect.
Toutes les choses sont parfaites.
So another patient, we do change disc with cage.
Nous changeons avec un cage.
This again planning on robot, planning. See the planning.
C'est la planification encore avec le robot.
And then you put this cage and expand it. See the last image, you increase height.
Vous mettez le cage et puis vous étendez, vous vous étendez.
This final position after change of disc and fixation.
C'est l'image finale après le changement du disque.
Only 2 small cuts.
Seulement 2 petites coupures.
Another patient, infection, TB. They must be having lot of TB in spine, which eat the bones.
Il y a un autre patient avec TB, tuberculose, et cette maladie mange les os.
This is failed surgery, failed.
C'est une chirurgie qui a échoué.
See, we did the reconstruction and put new cage.
C'est la reconstruction avec un nouveau cage.
And proper 100% perfect alignment.
L'alignement, c'est parfait 100%.
So last few cases where we do scoliosis correction.
La correction de scoliose.
So scoliosis of 3 types: congenital, idiopathic, neuromuscular.
Il y en a 3 types. Il y a congénital, idiopathique et neuromusculaire.
Yeah, so all of them require surgery at different stage. What are the warning signs to detect scoliosis?
Quels sont les signes qui prévoient la scoliose?
Yeah. If one shoulder is higher than other.
Un épaule est plus haut que l'autre épaule.
If head is not centered on the pelvis, patient is tilting.
Si la tête n'est pas centrée sur le pelvis.
If one of the hip is more proud, more prominent, one hip outside.
Si une hanche est plus prominente que l'autre.
If one rib cage, one side chest is out.
Si votre cage des os vertébraux sont sortis.
Any problem on the skin in the back, like there is a puckering dimple or there is a patch of hair or any color change like brown color, the skin change.
il y a changement de couleur de votre peau, peau de votre dos.
So in patients with less than 25-degree curve, we wait, no surgery.
Si, si la couverture c'est moins de 25 degrés, il n'y a pas besoin de chirurgie.
This is for idiopathic.
C'est pour idiopathique.
Yeah, for 25 to 40, we use brace.
On utilise dressing pour la degré entre 25 à 40 degrés.
So more than 40, surgery.
Si, s'il y a, s'il y a plus de 40 degrés, il faut faire la chirurgie.
So this is all for idiopathic.
C'était pour l'idiopathie.
For congenital, like hemivertebra, surgery, always surgery at 4 or 5 years.
Avec le problème congénital, il faut faire la chirurgie tous les 4 ou 5 ans.
For neuromuscular also, if there is breathing problem or balance problem, then you do surgery.
Avec neuromusculaire, si vous avez problème d'équilibrer, si vous ne pouvez pas rester debout de manière équilibrée, vous devez faire la chirurgie.
So to remember, for idiopathic, when their curve increase more than 40 degree, refer for surgery. For congenital, always surgery at 4 years.
Pour congénital, la chirurgie tous les 4 ans. Mais pour l'idiopathie, la couverture, si votre couverture c'est plus de 40 degrés, il faut faire la chirurgie.
And for neuromuscular also surgery.
Pour le neuromusculaire aussi, il faut la chirurgie.
So this patient, one example, TB spine, damage the spine, and there is 90 degree curve, 90 degree.
Il y a une curvature de 90 degrés.
We did surgery, resect the one whole bone, vertebra, and make correction.
Il fallait faire un trou dans une vertèbre et faire la correction, faire la corriger dans la région.
She came on a wheelchair with grade 2 power, no walking.
Elle est venue avec la chaise mobilière, elle ne pouvait pas marcher.
Now, after 4 weeks of surgery, she has started walking.
Après 4 semaines de chirurgie, elle a déjà commencé à marcher.
So great improvement in her neurological power.
Il y a une bonne amélioration dans sa capacité neurologique.
Another patient with early onset, this is scoliosis, child with syndrome.
Shivansh?
Il y a un autre patient avec yes.
No, please.
Scoliosis, syndromic scoliosis.
Il y a un autre patient avec la scoliose qui avance, qui monte.
Look at the picture. Kyphoscoliosis, kyphosis, scoliosis, both.
Kyphoscoliosis.
Yes. Growth rod. We put growth rod with the screw and rod.
Nous insérons un métail pour assurer la croissance.
Slow correction and increase in height over 3-4 years. Slow correction.
La correction lente pendant 2 ou 3 années.
Another patient where bad surgery. This surgery failed outside.
Il y a un autre patient avec la chirurgie qui a échoué.
Look, very bad curve. Scoliosis, very bad. And kyphosis also.
Son problème est très grave.
Kyphosis, scoliosis. We did correction.
Nous avons fait les corrections.
So this was 90 degree and 90 degree, two curves. Now we have only one curve, which is 40 degrees.
Il y avait deux curvatures de 90 degrés. Maintenant, ça a été réduit à une curvature de 45 degrés.
And all surgery under neuromonitoring. So all signal okay after surgery.
Toutes les chirurgies ont eu lieu avec neurosurveillance.
So no damage, safe spine surgery.
Pas de dommages. Très sûr et sécurisé.
Another scoliosis, see, this scoliosis correct, complete.
C'est un autre cas de scoliose complète.
See, before, after.
Avant et après.
Another patient, see, very bad curve like this, almost 100 degree.
Un autre
Completely
patient
corrected.
avec un autre patient. Ça a aussi été corrigé.
See before surgery, see, and see after surgery.
C'était avant la chirurgie et c'est après la chirurgie.
Another patient who has a deformity in the cervical spine, neck.
Un autre patient avec la déformité dans l'épine cervicale.
See, very bad scoliosis here and kyphosis.
Scoliose très grave et kyphose.
After surgery, complete correction.
La correction complète après la chirurgie.
We remove whole vertebra. This surgery 8 to 10 hours.
Nous avons enlevé, nous avons retiré toutes les vertèbres après la chirurgie.
So last case, very difficult case. Example, what happened when patient refer late to us?
C'est ce qui se passe quand le patient consulte le médecin très en retard, si le médecin ne va pas en amont.
So this patient has hemivertebra. Right time of surgery 4 years, but patient come to me at 16 years.
Le patient est venu chez le docteur après 16 ans et il devrait être allé chez le docteur dans 4 ans.
Because many doctors not aware that this patient surgery should happen at 4 years. So everybody thinking child is small, so surgery getting delayed.
Tous les docteurs ne savent pas que la chirurgie doit avoir lieu dans 4 ans. Ils ont pensé que le patient est très jeune, très petit, donc ils n'ont pas pu faire la chirurgie.
So hemivertebra.
Un autre cas de vertèbre herniée.
Yeah. So this child, if come at 4 years, surgery only 4 hours, small surgery.
Si vous allez chez le docteur dans 4 ans, vous allez seulement avoir une chirurgie de 4 heures. Mais oui, yes.
So now patient come at 16 years, big surgery because big deformity.
Et après 16 ans de la maladie, il faut avoir une grande chirurgie au lieu d'une petite chirurgie.
So this big surgery.
C'est une grande chirurgie.
This remove bone, put cage. Now correct after 16 hours of surgery. 16 hours.
La chirurgie a requis 16 heures.
We use latest ultrasonic bone cutting. Ultrasonic bone cut. See.
Les coupures ultrasoniques des os sont utilisées. Vous pouvez voir dans la vidéo.
So we are paying the price for evolution. Now, computer age, same problem, back problem too much.
Nous faisons face au problème de mal au dos et nous payons pour notre évolution.
Lifting heavy load and working on computer.
Nous prenons des choses qui sont très lourdes et nous essayons d'avoir l'ordinateur pour nous tenir longtemps.
So I have more than 15,000 operated patients, around 1,000 from Africa. From every country in Africa, I have operated every country.
J'ai fait des chirurgies des patients de tous les pays d'Afrique. Chaque pays d'Afrique, j'ai fait l'opération.
So Kenya.
Bravo pour le Congo.
What is that?
J'ai dit bravo pour le Congo.
Congo, yeah, here Congo. Congo
I am
here.
very glad to see the Congo.
Yeah, thank you. Say thank you.
Yes.
Merci. Il dit merci.
Thank you. So from Kenya, Tanzania, Djibouti, Ethiopia, Congo, Nigeria, Zimbabwe, South Africa, Ghana, Sudan, even Sierra Leone, Gambia, Ivory Coast, Senegal, Egypt, everywhere I've got patient I've operated from every country.
Here I can happily add that two of Jivo's patients also, Dr. Girdhar operated and in Congo from Kinshasa.
Very nice.
Dr. Girdhar's involvement doesn't end with the surgery. So those patients have had post-treatment follow-up consultations with Dr. Girdhar about how they are progressing and how they are doing. So sir, and there will be many more.
Yeah, we hope so. Translate, please.
Il y a deux patients de Jivo aussi, Dr. Girdhar a opéré sur eux et nous espérons voir plus de patients dans l'avenir aussi.
Oui, vous en aurez. Il y en aura beaucoup. They will come.
Dr. Girdhar, we have got some live questions from the audience. If I can
please.
So
I have lots of questions on the chat also.
Yeah,
so somebody says wonderful talk, salute. Thank you very much.
Yeah.
If you like the talk, then my day is made. On Sunday I leave my family to do this. It is worth it.
Sorry, Dr. Girdhar, we for inconvenience
no problem
on Sunday, but
no problem. It is worth it. It is worth it.
When doctors are free. So, Dr. Kavele, you have so Dr. Kavele has asked a question, and you have treated few of his patients.
Yeah, Kavele. Yes, I can see his questions. Yes.
Yeah. How long will it take? If you can read it, how long will it take with rehabilitation
for a patient to regain full mobility after arthrodesis? Why is the spinal arthrodesis technique still the choice while the majority of the patients who benefit from it develop vertebral listhesis after years? So I can answer both the questions. Dr. Kavele, does he understand English, I believe?
No, sir. Little bit, but French, Shivansh will have to translate. Shivansh, please pay attention to.
So one line, first question answer. In whole my presentation, I have been saying spinal arthrodesis in today's era with minimal invasive and robot. You make the patient walk same day. From next day, he is getting discharged in 1 to 2 days. In 1 week, he can go back to work, his home. In 3 weeks, he can go back to active sports.
Comme j'ai déjà dit dans toute ma présentation, avec cette technique moderne que nous avons, le patient peut récupérer très vite et il peut marcher très vite, il peut rentrer chez lui très vite aussi.
The second question, why is spinal arthrodesis technique still the choice? Because it is by far the best possible solution science has invented so far.
C'est la meilleure solution pour la colonne vertébrale que la science a, que la science a inventée.
So patients who develop vertebral listhesis are not majority. I operate 1,000 patients in a year. There will be problem with other joints, other levels. So today, if a patient is okay, you translate that.
Sir, what is the name of the spinal? What did you say? Spinal listhesis?
Listhesis, yes. Spinal
Uh,
listhesis will happen in some patients, not most patients.
Listes épinière n'arrive pas à la plupart des patients. C'est quelque chose qui arrive à seulement un peu de patients.
And there is a solution for that also.
Il y a aussi une solution pour ça.
Just because some surgery will have problem many years down the line does not mean that we should not give patient the benefit today when he is getting paralyzed. Patient is having too much problem, not able to walk, pain. You have to do the surgery. Maybe some of them after many years will require another level.
Les chirurgies peuvent avoir des complications beaucoup d'années plus tard, mais pour maintenant, il faut que nous fassions la chirurgie pour traiter les paralysies, pour les permettre de marcher, etc.
Like liver transplant, we know a patient will have possibility of 5 to 10 years of life, but we still do it, right? Because otherwise patient is very sick today and is suffering.
Par exemple, quand nous faisons le transplant de foie, nous le faisons malgré le fait que le patient a seulement 5 ou 10 ans de vie après ça. Mais nous le faisons quand même parce que nous voulons améliorer la vie du patient.
The next question is
knowing yeah, this one.
Nobatur Odamtar. And knowing that the normal disc diameter is around 14 to 20, what is the limit for which there is a need for surgery? Example, for someone who has only 7 mm between and he is still working. So answer to this is don't measure the millimeters, measure the patient's symptoms. Surgery depends on patient's symptoms and what treatment he has taken so far, not on the measurement.
So there is a lot of information. Okay, Shivansh, continue, Shivansh.
La chirurgie dépend des symptômes du patient et non sur les dimensions du disque.
Sir, he has shared some further information. The patient above has 2 surgeries with arthrodesis S1, L4. Yeah. This question was there on my WhatsApp before also. So the 7 mm is not the problem. If the patient has pain in the leg, then it's a problem.
Si le patient a mal à la jambe, c'est le problème, mais autrement non, ce n'est pas un problème.
So if the patient is not getting relief with medicines, or physiotherapy, patient will require surgery to extend fusion.
Sir, can you please repeat?
If patient is not getting benefited with medicine and physiotherapy, he will require surgery for this problem.
Si les médicaments et la physiothérapie ne marchent pas, il faut faire la chirurgie enfin.
This is easier. Now, after that, what are the new advancements in CS spine? Like cancer spine? I don't know what the question is. Leading to quadriplegia. If there is, okay, let's talk about quadriplegia. If there is, okay, if there is a patient who has quadriplegia, you have to find out the cause. Why quadriplegia happen?
Vous devez trouver la cause de. Sir, what's the name of the problem?
Quadriplegia, paralysis.
Vous devez trouver la cause de la paralysie si vous avez le problème.
And if we know the cause, we can remove the cause.
Si nous connaissons la cause, nous pouvons retirer la cause.
So I have one more request for the last two questions, that they are talking about specific patients. So tell them to share their reports of these patients so that I can reply by drawing images, and I will send complete reply translated in French.
Okay. No, this instruction I'll pass to GO team member. So
yes.
Whoever is the relationship manager of these two doctors, please contact them, ask for the relevant patient information.
Yes.
Share it in an organized format with Dr. Puneet, and he will give his response. And Dr. Puneet, we will do the French translation. Please don't worry about it. You just give your English.
Okay.
And sir, there were a few more questions. If I can, they were shared with you in advance. If I can read them.
Answer from the phone if you want me.
Yeah, you can read yourself, sir.
Yeah, I can't see them on the screen. So, but I have. Those are the questions.
I'll just share the screen. Sir.
Yeah, I have it. So what is your next question is, what is your motivation for organizing this webinar? I can ask the same question. What is your motivation to attend this webinar? It's the same motivation I have.
Yeah, I will, sir, Dr. Puneet, if you allow me, in the beginning, what I joined, see what GIVO is doing, healthcare should be handled by doctors on one side in India, and not by agents, even not by corporate types like us. We are just building a platform so that communication between doctors like Dr. Girdhar, where excellence lies, and doctors and African colleagues. So it all starts with dialogue, and then solutions come. That is the purpose of GIVO. In 5 to 10 years, our dream is the agents should be out of the business, and doctors from Africa or Middle East or Bangladesh or anywhere, they would know which are the relevant professionals, and the dialogue and treatment solutions, they start from there. So the objective of organizing these seminars is you get to know doctors like Dr. Girdhar. They share their experience with you, as he had shared the advancements, the things that they do day in and day out, and this magic starts. That's the main objective. And wherever you need help in complex cases, GIVO is a channel for you to formally approach Dr. Girdhar for the solutions, whether they are possible in the home country or they are possible if the patient comes to India. That is the basic purpose, sir.
Shivansh, can you translate this? Once again, this is the message to be reiterated again and again and again.
Shivansh, I can repeat if you want.
I think he understands the gist of it. He will explain the gist.
C'est que GIVO Sir, I would like if you just give a small
Okay,
repeat it just
Shivansh, to
once.
make your life
Two
simple,
lines. Yeah.
our French audience is from DRC. I
Yes.
am going to be in Kinshasa tomorrow. I'm anyway going to meet them. They can
Okay.
meet me.
Okay.
And
You are welcome. You are welcome.
yeah, I'll be in Kinshasa tomorrow. One of the local doctors, Dr. Kavele, who is our national coordinator there, is going to be with me. And if a lot of you meet me, we can request Dr. Puneet and a few of his colleagues for a small informal chat over Zoom with you,
Yes.
5-10 minutes. We can do that next 1 week.
If
So,
if they invite me, I will come to Congo also.
sir, I will. We are working.
You are welcome.
We are
It is
welcome.
welcoming
Yeah.
only Mr. Varun, not me.
Dr. Girdhar, let's hope
you
things
so.
go well in next 6 months. I
will give
expect to
the
visit all African countries with you.
what I'm trying to say, you will understand in the next question. This is a brilliant question. Next one, I would like to answer that.
Okay.
Yeah.
So, what are the plausible obstacles to performing minimal invasive spine surgery in tropical areas? My answer is there is no obstacle. The obstacle is in the mind.
Ah.
Il n'y a pas d'obstacle dans la chirurgie de l'invasion, la chirurgie invasive minimale. Il n'y a pas d'obstacle, il y a seulement des obstacles dans la tête.
I will give you an example for that. So I would love to do it with Jivo this time in Congo, what I did in Nigeria. In the last 2 months, yeah, first you translate.
J'aimerais faire ce que j'ai fait en Niger, j'aimerais le faire aussi au Congo.
So if Congo is finding it challenging to do minimal invasive spinal surgery there routinely, Nigeria was also finding the same challenge.
Niger trouvait aussi les mêmes défis que le Congo aujourd'hui.
In last 2 months, we did 3 minimal invasive spinal surgeries in Abuja, and one of them was revision, already operated. No, sorry, 2 of them were revision, already operated, laminectomy done. All 3 patients started walking on next day, and now I am getting phone calls from 10 different hospitals to start minimal invasive there. So it's a matter of time that somebody takes that initiative. I think Jivo will do it. They are driven. Jivo is driven to do it. It all happens with the collaboration of the local doctors who are keen on taking it forward. And webinars like these are motivating for us. Whatever I'm trying to show is to make you believe that if we can do it here, you can do it there.
So I think
Il faut...
no,
il faut des initiatives des niveaux locaux et il faut que les docteurs, les médecins, ils font des efforts pour introduire les chirurgies, les chirurgies invasives minimales. Et ça a déjà été fait dans les autres pays d'Afrique.
So we are trying up hospitals in Nigeria where we have done minimal invasive surgery. We are calling their doctors to India for training. We are doing a program to make spine surgery minimal invasive from local doctors in future.
Your voice is not very clear.
No, but it was there in the text. Okay.
Yeah,
Sir,
it is something that we have done in Nigeria. We have started minimal invasive program there, and we will love to do it in Congo also with our local doctors in Congo.
Shivansh, can you translate this?
Nous avons déjà fait ça en Niger. Nous voulons aussi reproduire et répliquer ça au Congo et à l'aide des docteurs, les médecins dans le pays.
Okay, so I'm tomorrow. I'm in Kinshasa. I'm there for a week. All of you doctors and additional doctors and clinical setup will meet. You tell me and give me some information, relevant information. Once I'm back, I'll meet with Dr. Girdhar. And if see, a doctor will travel if there is significant work to do. If he's convinced that there is significant work to do, Dr. Girdhar is senior enough to get BLK on board, and next visit with your support. See, without your support, we can't do much. You are the doctors there. So with your support, we can plan to do these things and demonstrate that these things are possible. Shivansh, please translate this.
Et c'est seulement avec votre soutien et votre aide, nous pouvons faire ces efforts et si les médecins trouveront qu'il y a besoin de beaucoup de travail là, ils vont définitivement le faire. Mais votre soutien est très important pour que nous puissions le faire.
Bien accepté.
So there is one more last question. What would be the medical method for the management and support of individuals with discopathy? There are a lot of treatments for that. One is medicines and physiotherapy. Can you translate that?
Il y a beaucoup de traitements, il y a les médicaments et il y a la physiothérapie pour ce problème.
The other options are we give one injection, nerve block.
Nous faisons la piqûre, nous bloquons le nerf.
And if everything fails, then we can do endoscopic surgery.
Si toutes les autres choses échouent, nous faisons la chirurgie endoscopique.
Wow. I am thankful to Dr. Andrew, Dr. Andrew, Dr. Isaiah. They have enjoyed the talk, it seems.
So Dr. Elaine is asking a very interesting question, and I think that is for larger audience. So he asks, good afternoon, Dr. Puneet. I really appreciate, sir, all this spine correction you made. Really, it is a word of honor to job. My question, please, is what will someone do to be your assistant? Now I want to answer this. Why do you want to be Dr. Girdhar's assistant? He is ready to be your guide and, be a partner. You have a platform to, approach Dr. Girdhar anytime through your GO. But sir, if you have really, if somebody can be your assistant, you can answer that technical question. So through GO, you can partner with Dr. Girdhar.
We have training programs. We have training programs in India where we get fellows from Africa.
Nous avons des programmes d'entraînement et nous avons des fellows, nous avons des collègues d'Afrique.
It's good.
You tell him you don't have to be my assistant, you can be my colleague.
That's what.
Vous n'avez pas besoin d'être mon assistant, vous pouvez être mon collègue.
Dr. Elaine, thank you very much.
Okay.
Thank you so much. Thank you. Thank you, sir. Thank you. I appreciate it, really.
You are welcome. I tried my best. I hope I have not disappointed any of you.
No, sir, it was very informative. And sir, one question, I think the gentleman is not here.
No
Sir,
problem.
in these spine problems and, you have discussed a lot of treatment like medication,
Yes.
physiotherapy, and you say surgery is only in the last option and the candidate is the fit candidate for surgery.
Yes.
Does nutrition play any role in, I mean, in let's say if I'm healthy now and if some nutrition definite, is it a risk for somebody to develop a spine later or in recovery, etc., or is it not that significant factor?
Like spine is made up of three things mainly. One is the bones, second is muscles and tissues, third is nerves. So for we want to translate for everyone?
Uh,
Okay, I can do that.
Depends on how much time you have, sir. I think we already overshot the time limit.
No problem. Another 2-3 minutes. 6:30 is still okay.
Okay. So you can translate, Shivansh.
La colonne vertébrale compose de trois parties. Il y a les os, il y a les tissus et les muscles, et il y a les nerfs. Yes.
So you need calcium and vitamin D and sunlight for bones.
Vous avez besoin de calcium et vitamine D pour les os.
And for muscles, you need exercise.
Pour les muscles, vous avez besoin de vous entraîner et faire de l'exercice.
And good protein in your diet.
Et assez de protéines dans votre nourriture.
And for the nerves, you need exercise and vitamin B12.
Vitamin B12 and?
Exercise.
Pour les nerfs, vous avez besoin de vous entraîner, faire les exercices et aussi vitamine B12.
So altogether, good lifestyle, good diet, and good exercise. These three things are a must to keep our spine healthy.
And
En somme toute, vous avez besoin de bonne nourriture et vous devez bien faire de l'exercice pour rester en pleine forme.
So many doctors are asking Dr. Puneet's visit plans to different countries. What we will do, we'll coordinate with his coordinator. And whenever he is visiting, let's say Nigeria, we'll inform all of you in advance so that locally who can meet him can meet him.
Yeah, no problem at all.
For other countries, sir, someone from the team will coordinate with Bhavna around this. And whenever you're visiting these countries, we'll circulate the information so that they can meet you.
Yeah, there is the Dr. Alain has put something in French. I don't know how to read that. Can somebody translate that?
I will do so.
I can't see that message actually.
Last chat, Dr. Alain Kabakuli.
Okay, yes, I got it. Yeah. À quel moment nous pouvons dire pour la scoliose que je pensais a échoué, indiqué? At which moment can we say for the scoliosis that the bracing has failed and indicate that the surgery, and at which point can we say that it has failed and we can do surgery? And secondly, for the interbody cage, can we not use long plaques of Roy Camille? Long plates of Roy Camille.
Okay, the first question, if the curve goes more than 40 degree, 40 to 45, then surgery.
And so second part of the question is interbody cage.
Yeah, at what point so the interbody, do you not secure it with long plates? We use nowadays nobody uses Steffi plating or anything. We are using for last 15-20 years, we are using transpedicular screws and titanium or PEEK cage.
This is your question. It was in French. Can you, Shivansh, can you repeat it?
15
heures.
Sir, can you just repeat that? Sorry, I just...
Sir said that they don't use those plates anymore. They use titaniums, etc., and many other.
Titanium cage and pedicle screws.
Nous n'utilisons plus les plaques de telle sorte. Nous utilisons des cages Nous utilisons des cages d'autres métaux comme titanium et les autres métaux.
Sir, Dr.
Yes.
Saya
Yes.
has one comment. He's ready to work with you and wish to communicate whenever patients are available. Dr. Isaiah, please do that. Whenever you think some patient may need Dr. Girdhar's opinion on his health, contact your GO relationship manager. They will guide you through the process.
I have a suggestion
Thank you
here.
so much.
I have a suggestion here.
Yeah.
Like most of the doctors think that it will not be easy for Dr. Puneet or our team to reply to their questions daily. So I must tell them that I reply close to 40 emails and at least 30 WhatsApp images and questions on everyday basis.
Correct, sir.
Every day.
You
And
do
I
that.
would be more than happy. We must tell them if they are sitting in the clinic, they have a patient with an X-ray, MRI, and they need a suggestion of a colleague. They should not hesitate. Just one WhatsApp to GIVO, and they will get the reply on the same day or next day.
And this I can vouch.
This
And Dr.
they
Puneet
they
performs
translate, yeah.
multiple surgeries every day. This will be done, Dr. Elaine and Dr. Isaiah. Whenever you have a patient, share the information. Dr. Puneet's team is very responsive, and Dr. Puneet personally sees all the queries.
We appreciate you so much, sir. Thank you so much.
Wow, super, Dr. Isaiah. Thank you for your compliments. I read them. I really appreciate from the bottom of my heart. Do stay in touch with us. Anything you need, any information, any elaboration on your spine patients you need for making a great diagnosis, or you need any help in their treatment, do not hesitate. Just connect with us.
Okay, sir.
Much appreciation, sir. Much
So we
appreciation.
can conclude this. I think we have taken more than half an hour of everybody. I think many people have left also. So, Dr. Puneet, if we have your permission, we can end this. And a big thank you to you for taking time out on Sunday. And
No, you're welcome. I am glad that with the kind of response we got and the participation and the quality of questions, I believe that this was worth it. And there are many enthusiasts in that country, in their countries, who are keen on taking spine forward and also helping the patients in their own country with modern technology and modern techniques.
so next time when we organize another webinar for you, so because we are very early stage, but next time probably a couple of 100 doctors, more interaction.
Thank you.
Let's target that, sir.
Thank you. Oh man, we are still getting a lot of responses.
Yeah, so somebody suggesting that we should circulate among the patients also. Yes, Dr. Elaine, and we will be sharing a clean version of this video, like with some editing, and of course snippets. You are free to circulate them. The idea is to help you also spread awareness that you are connected to excellent surgeons like Dr. Girdhar and can get patients the requisite help, whether they just get in touch with Dr. Girdhar. I think he will be able to guide you better what needs to be done for what patient. Thank you. Dr. Girdhar, if your permission, we can end. And thank you everyone who attended today. Looking forward to more such sessions.
Yes, it was a great association. Thank you so much. Thank you, everyone.